Are you curious about Xanax? This powerful medication has gained significant attention in recent years for its potential uses, recommended dosage, and possible side effects. Whether you're seeking relief from anxiety, panic disorders, or even insomnia, Xanax may be a viable option for you. In this comprehensive guide, we will demystify Xanax and explore its potential benefits and risks. We'll delve into the recommended dosage, ensuring you understand how to take this medication safely and effectively. Additionally, we'll discuss the possible side effects you should be aware of, allowing you to make an informed decision about whether Xanax is right for you. So, if you're looking to gain a deeper understanding of Xanax and how it may help improve your quality of life, keep reading. Let's unlock the potential of this medication together. What is Xanax? Xanax, also known by its generic name Alprazolam, is a prescription medication classified as a benzodiazepine. It is primarily used to treat anxiety disorders, panic disorders, and is sometimes prescribed for insomnia. Xanax works by enhancing the effects of a neurotransmitter in the brain called gamma-aminobutyric acid, GABA. GABA is responsible for calming down the nerve activity in the brain, which helps reduce feelings of anxiety and promote relaxation. Xanax comes in different forms, including immediate-release tablets, extended-release tablets, and oral solutions. The dosage and frequency of Xanax intake will depend on the individual's condition and the severity of their symptoms. It is important to note that Xanax should only be taken under the guidance and supervision of a healthcare professional. Potential uses of Xanax. Xanax is primarily prescribed for the treatment of anxiety disorders. These disorders can range from generalized anxiety disorder, GAD, to panic disorder, social anxiety disorder, and even post-traumatic stress disorder, PTSD. Xanax helps alleviate the symptoms associated with these conditions, such as excessive worry, restlessness, irritability, and difficulty sleeping. In addition to anxiety disorders, Xanax is also occasionally prescribed for insomnia. It can help individuals who have trouble falling asleep or staying asleep due to anxiety or racing thoughts. However, it is important to note that Xanax should not be used as a long-term solution for insomnia, as it can lead to dependence and other side effects. How does Xanax work? Xanax works by increasing the activity of GABA in the brain. GABA is an inhibitory neurotransmitter that reduces the excitability of nerve cells, resulting in a calming effect. By enhancing GABA's effects, Xanax helps to reduce the excessive activity in the brain that leads to anxiety and panic. When taken as prescribed, Xanax can provide relief from anxiety symptoms within a short period of time. It is typically fast-acting, with effects felt within 30 minutes to an hour after ingestion. However, it is important to note that Xanax is not a long-term solution for anxiety disorders. It is intended for short-term use to manage acute symptoms and should be used in conjunction with therapy and other non-pharmacological interventions. Recommended dosage of Xanax. The recommended dosage of Xanax varies depending on the individual's age, medical history, and the severity of their symptoms. Typically, Xanax is prescribed at the lowest effective dose to minimize the risk of side effects and dependence. For anxiety disorders, the usual starting dose is 0.25 to 0.5 milligrams taken 3 times daily. This dosage may be gradually increased if necessary, but it should not exceed 4 milligrams per day. For panic disorder, the initial dosage is often higher, ranging from 0.5 to 1 milligram taken 3 times daily. Again, the dosage may be adjusted based on the individual's response to the medication. It is important to follow the prescribed dosage and avoid increasing or decreasing it without consulting a healthcare professional. Abruptly stopping Xanax can lead to withdrawal symptoms, including rebound anxiety, insomnia, and irritability. If you feel that your current dosage is no longer effective or if you are experiencing side effects, it is crucial to speak with your doctor to discuss potential adjustments. Possible side effects of Xanax. Like any medication, Xanax can cause side effects. Common side effects may include drowsiness, dizziness, headache, and dry mouth. These side effects are usually mild and temporary, but if they persist or worsen, it is important to inform your healthcare provider. In some cases, Xanax can cause more serious side effects. These may include confusion, memory problems, difficulty concentrating, slurred speech, and unsteady movements. If you experience any of these symptoms, it is important to seek medical attention immediately. It is worth noting that Xanax has the potential for dependence and addiction, especially if taken in higher doses or for longer periods than prescribed. Abruptly stopping Xanax can lead to withdrawal symptoms, including rebound anxiety, insomnia, and seizures. Therefore, it is important to follow the prescribed dosage and consult with a healthcare professional before making any changes to your medication regimen. Precautions and warnings when taking Xanax. Before taking Xanax, it is important to inform your healthcare provider of any pre-existing medical conditions, including liver or kidney disease, respiratory problems, glaucoma, or a history of substance abuse. Xanax may not be suitable for individuals with certain medical conditions or those taking certain medications. Xanax should not be taken with alcohol or other central nervous system depressants, as this can increase the risk of sedation and respiratory depression. Additionally, Xanax should not be taken during pregnancy or while breastfeeding, as it may harm the baby. It is crucial to be honest with your healthcare provider about any medications, supplements, or herbal remedies you are currently taking, as they may interact with Xanax and affect its efficacy or increase the risk of side effects. Xanax and addiction. Xanax has a high potential for dependence and addiction, especially when used in higher doses or for longer periods than prescribed. It is classified as a Schedule IV controlled substance, indicating a moderate risk of dependence and abuse. If you have a history of substance abuse or addiction, it is important to discuss this with your healthcare provider before starting Xanax. They may recommend alternative treatments or closely monitor your use of the medication to minimize the risk of addiction. Xanax versus other anxiety medications. Xanax is just one of many medications available for the treatment of anxiety disorders. Other commonly prescribed medications for anxiety include selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, and buspirone. Xanax is typically reserved for short-term use due to its potential for dependence and addiction. SSRIs and SNRIs, on the other hand, are often prescribed for long-term management of anxiety disorders. These medications work by increasing the levels of serotonin or both serotonin and norepinephrine in the brain. Buspirone, a non-benzodiazepine medication, is also used for long-term treatment of anxiety disorders and has a lower risk of dependence. The choice between Xanax and other anxiety medications depends on various factors, including the individual's specific diagnosis, medical history, and preferences. It is important to work closely with a healthcare professional to determine the most appropriate treatment option for your unique needs. Xanax alternatives. If you're seeking alternatives to Xanax for the treatment of anxiety, there are various options available. Non-pharmacological interventions, such as therapy, relaxation techniques, and lifestyle modifications, can be effective in managing anxiety symptoms. Additionally, alternative medications, such as SSRIs, SNRIs, and buspirone, may be considered as alternatives to Xanax. Natural remedies, such as herbal supplements and essential oils, are also popular alternatives for managing anxiety. However, it is important to note that the efficacy of these remedies varies, and they may not be suitable for everyone. It is advisable to consult with a healthcare professional before starting any new treatment regimen. Conclusion. Xanax is a powerful medication that can provide relief from anxiety disorders, panic disorders, and insomnia. It works by enhancing the effects of GABA, a neurotransmitter that promotes relaxation and reduces anxiety. However, it is important to use Xanax responsibly, as it has the potential for dependence, addiction, and side effects. Always follow the recommended dosage and consult with a healthcare professional to ensure safe and effective use of this medication. Remember, Xanax is just one option among many available for the treatment of anxiety, and alternative treatments may be considered based on individual circumstances. Thanks for watching.